One of the frequently asked questions that we receive is, what is the InterStim device? Overactive bladder is a condition of urinary urgency and/or urinary incontinence, which is often initially treated with lifestyle modifications, pelvic floor exercises, sometimes medications, but if those fail, then you're introduced to more advanced therapies. InterStim is a sacral neuromodulator that is installed under the skin near the nerve that controls your bladder, and it normalizes your bladder function so you can regain your quality of life. It is powered by a battery that may look like this or a smaller version as well. The difference between these two batteries is that this battery is a plug-and-play type battery. Once it's installed, you don't have to worry about it. It functions for a period of 5 to 10 years and then can be replaced. This battery is a little bit smaller, but it does require recharging on a weekly basis, and it is recharged by placing this over the skin on top of the battery. Aside from that difference, both are MRI compatible. They are both controlled via a cell phone looking external controller that you can use to adjust your settings so that your symptoms are better controlled over time. We do a bladder test in the office called a peripheral nerve evaluation, or PNE, that allows us to see if you're going to be a candidate for this device and if you're going to have any kind of response. If you do have 50% or more improvement in your symptoms, then we may take you to the procedure suite where we place this under the skin, and depending on your preference, we use either the small battery or the non-rechargeable one that is more of a plug-and-play type battery.